Have you ever wondered why reflux keeps coming back no matter what medication you take? Maybe you've tried antacids, maybe you've taken acid blockers, maybe the burning improved for a while, but then the symptoms returned. The throat clearing came back. The cough came back. The pressure in your chest came back, and you found yourself asking the same question many people over 60 eventually ask: why isn't this problem actually going away? The answer may surprise you, because for many older adults, reflux is not primarily an acid problem. It's a valve problem. And until you understand that distinction, it's easy to spend years treating the symptom while never addressing the cause. Welcome back to Dr. Amelia Heart Health. Today, we're going to talk about something that completely changed the way many of my patients understand reflux. We're going to discuss the stomach valve. More specifically, we're going to discuss why it stops working properly as we age and what practical steps may help support its function naturally. Now, before we begin, I want to clarify something important. When people talk about reflux, they usually imagine acid rising from the stomach into the esophagus. That picture is partly correct, but it leaves out the most important piece of the story. Think of your digestive system as a house with plumbing. If water is leaking into the wrong room, the first question shouldn't be, how much water is there? The first question should be, why is the door supposed to contain it no longer doing its job? The same principle applies to reflux. Inside your body, there is a muscular valve located between the esophagus and the stomach. Doctors call it the lower esophageal sphincter, often shortened to LES. You don't need to remember the medical term. Just think of it as the stomach valve. Its job is simple. Food goes down. Stomach contents stay down. Every time you swallow, the valve briefly opens. Then it closes again. When it works properly, stomach acid remains exactly where it belongs. When it becomes weak, relaxed, or overwhelmed by pressure, stomach contents begin moving upward. That's reflux. Notice something important here. The acid itself isn't moving upward because it wants to. It's moving upward because the barrier designed to stop it is no longer functioning effectively. That changes everything. Because if reflux is largely a valve problem, then simply reducing acid doesn't fully solve the issue. It's like placing a towel under a leaking pipe. The towel may reduce the mess, but the leak still exists. One of the biggest reasons reflux becomes more common after 60 is that several changes occur inside the body at the same time. Muscle tone naturally decreases, connective tissues become less resilient. Digestion slows. The stomach empties more slowly than it did decades earlier. And small amounts of abdominal pressure that were once manageable begin creating problems. Many people don't notice these changes happening. They happen gradually, year after year, meal after meal. Until one day they find themselves clearing their throat every morning or waking up with a bitter taste in their mouth. The frustrating part is that these symptoms often appear without classic heartburn. That's why so many people spend months or even years looking for answers in the wrong places. Some think it's allergies, others blame sinus problems. Many assume it's simply aging, but the stomach may be involved, even when there is no burning sensation at all. And that brings us to one of the most misunderstood forms of reflux. Silent reflux. Unlike traditional reflux, silent reflux often affects the throat more than the chest. People may experience constant need to clear the throat, a feeling that something is stuck, morning mucus. Hoarseness. Dry cough, frequent throat irritation. Because these symptoms don't feel digestive, they often go unrecognized. Yet the source may still be the same stomach valve. So the next question becomes, what actually causes this valve to fail? And more importantly, can you improve its function naturally? The answer begins with understanding pressure. Because pressure is often the hidden force behind reflux, and most people never realize how much pressure they're creating inside their stomach every single day. Part 2, the real reason the stomach valve stops working. Let's continue. If the stomach valve is the real issue, then the next logical question is, what causes it to open when it shouldn't? Most people assume the answer is acid, but in many cases, the answer is pressure. Imagine blowing air into a balloon. The more pressure you create inside, the more force pushes against the opening. Your stomach works in a similar way. Every meal creates pressure. That's normal. The problem begins when the pressure becomes greater than the valve can comfortably handle. And one of the most common reasons this happens after 60 is simply eating too much at one time. I'm not talking about overeating every now and then. I'm talking about the habit many people develop of eating until they feel completely full, that heavy feeling after a meal, that tight sensation across the upper abdomen, that need to loosen your belt. Those are signs that the stomach is under significant pressure. When pressure rises, the valve is forced to work harder. And if the valve is already weaker because of age-related changes, reflux becomes much more likely. One of the simplest habits that can dramatically reduce reflux is learning to stop eating before you feel stuffed. Many long-lived cultures follow a simple principle: eat until satisfied, not until full. The goal isn't hunger. The goal is avoiding excessive stomach pressure. A second source of pressure is abdominal weight. Excess fat around the abdomen pushes inward on the stomach throughout the day. Think of it like constantly squeezing a balloon. The more pressure placed on the stomach, the harder the valve must work. This is one reason why even modest weight loss often improves reflux symptoms, not because fat directly causes acid, but because reducing abdominal pressure allows the valve to function more effectively. Now let's talk about something many people do every evening without realizing its effect. Lying down too soon after eating. This may be one of the biggest reflux triggers of all. When you're standing or sitting upright, gravity helps keep stomach contents where they belong. But the moment you lie flat, gravity is no longer helping you. Now the stomach contents can move much more easily toward the valve. That's why symptoms often become worse at night. The body hasn't changed. The acid hasn't changed. The position has changed. For most people, waiting at least 3 hours after a meal before lying down can make a significant difference. And if reflux is especially troublesome at night, sleeping position becomes extremely important. Here's something fascinating. The stomach sits slightly toward the left side of the body because of this anatomy. Sleeping on your left side often helps keep stomach contents farther away from the valve. Sleeping on the right side can have the opposite effect. Many people discover that simply changing their sleeping position reduces nighttime symptoms more than they expected. Another common mistake is relying on extra pillows. People think raising the head with pillows will solve the problem. Unfortunately, pillows often bend the body at the waist and can increase pressure inside the abdomen. Instead, the entire upper body should be elevated slightly. That's why raising the head of the bed itself is often more effective than stacking pillows. Now let's discuss something people rarely connect to reflux. Clothing. Tight belts. Tight waistband. NDS. Compression garments. Anything that squeezes the abdomen can increase pressure against the stomach after a large meal. Even bending forward repeatedly can push stomach contents upward. Small habits matter more than most people realize. The body responds to pressure constantly, and the stomach valve is no exception. At this point, you may be starting to see the pattern. Reflux isn't always about acid. It's often about mechanics. Pressure. Position. Gravity. Valve. Function. Understanding these factors gives you something powerful called control. Because unlike age itself, many of these triggers can actually be changed, but pressure isn't the only thing that affects the stomach valve. Certain foods, drinks, and daily habits can directly weaken the valve itself. And some of the biggest offenders are things many people consume every single day without realizing the connection. That's exactly what we'll discuss next. Part 304: Hidden things that relax the stomach valve. Now that we understand how pressure contributes to reflux, let's talk about something equally important. The stomach valve doesn't only struggle because of pressure. Sometimes it actually becomes more relaxed than it should be. And when that happens, stomach contents can move upward much more easily. What surprises many people is that several common foods and habits can directly affect the valve itself. Let's start with the first one. 1. Mint. Most people think of mint as soothing. When they have digestive discomfort, they reach for peppermint tea. Mint candies, peppermint lozenges. And in many situations, mint can feel calming. But here's the irony: peppermint and spearmint may relax the lower esophageal sphincter. In other words, the very thing you're taking to soothe digestion may be making reflux worse. not everyone reacts the same way, but if you're dealing with persistent reflux and regularly consume mint products, it's worth experimenting with removing them for a few weeks. You may notice a bigger difference than expected. 2. Chocolate. This is one many people don't like. Hearing chocolate contains compounds that can relax the stomach valve. It also contains fat, and fat slows stomach emptying. That creates a double problem. First, the valve becomes more relaxed. Second, food remains in the stomach longer. Longer stomach emptying means more pressure. More pressure means more reflux. Again, this doesn't mean chocolate is forbidden forever, but if your symptoms are active, reducing chocolate temporarily may help you identify whether it's contributing. 3. Alcohol. Alcohol affects reflux in several ways. It can irritate tissues directly. It can relax the stomach valve. And it's often consumed during the evening when people are preparing for bed. That's a perfect setup for nighttime reflux. Many people notice that their symptoms are significantly worse after evening drinks compared with daytime consumption. The timing matters, the quantity matters, and the body's ability to manage reflux changes when you're lying down. Point 4. Nicotine. This may be one of the strongest and most consistent triggers. Nicotine reduces the resting strength of the stomach valve, not temporarily. Repeatedly. For people who smoke or regularly use nicotine products, the valve may spend much of the day functioning below its ideal strength. That's one reason reflux is so common among smokers. Many people focus on the lungs when they think about smoking. Few realize how much it can affect digestion. Now, let's address something people ask about constantly. What about coffee? Coffee has been blamed for reflux for decades, but the truth is more complicated. Some people drink coffee every day and experience no problems at all. Others notice symptoms almost immediately. Research on coffee and reflux has produced mixed results. What does that tell us? It tells us that individual responses matter. Your body is unique. Instead of automatically eliminating coffee forever, try becoming an investigator. Remove it temporarily. Observe your symptoms. Then, reintroduce it carefully. Let your body provide the answer. The same principle applies to tomatoes. Citrus fruits, spicy foods. And many other commonly blamed foods. Some people tolerate them perfectly. Others do not. The goal isn't living in fear of food. The goal is understanding your personal triggers. Unfortunately, many people start eliminating 10 foods at once. Then, they have no idea which food was actually causing the problem. Smarter approach is systematic testing. Remove one trigger. Observe. Reintroduce. Evaluate. Repeat. This creates clarity instead of confusion, and clarity leads to better decisions. Now there's another topic we need to discuss because it's become extremely popular online. Apple cider vinegar. Some people swear by it. Others say it's dangerous. So what's the truth? The answer is more nuanced than most headlines suggest. And that's exactly where we're going next. Because before you start trying home remedies, it's important to understand when they might help and when they could actually make symptoms worse. Part 4. Apple cider vinegar, silent reflux, and the mistakes that keep the valve open. Let's continue. By now, you've probably realized something important. Reflux is often far more complicated than simply having too much acid. For many people, the real issue is a combination of pressure, valve weakness, and digestive mechanics. But this is where many people make a mistake. They start searching for quick fixes, and one remedy appears again and again: apple cider vinegar. You've probably heard the claim. Some people say reflux happens because the stomach doesn't produce enough acid. According to this theory, low stomach acid leads to poor digestion. Poor digestion leads to fermentation. Fermentation creates gas. Gas increases pressure. Pressure pushes against the stomach valve. And reflux develops. Interestingly, There is some physiological logic behind this idea. In certain individuals, especially older adults, stomach acid production may decline with age. But here's what many people fail to understand. Even if low stomach acid is part of the problem, that does not automatically mean apple cider vinegar is the solution. Imagine your throat is already irritated. Imagine the lining of your esophagus is already inflamed. Now imagine pouring an acidic substance onto tissue that's already sensitive. You can see the problem. For some people, this may make symptoms significantly worse. That's why apple cider vinegar should never be viewed as a universal remedy. What helps one person may aggravate another. The internet often presents health advice as if everyone has the exact same body. They don't, and reflux is one of the clearest examples of that. Reality. Now let's return to something we mentioned earlier. Silent reflux, because this is where many people over 60 become confused. Traditional reflux usually causes burning in the chest. Silent reflux often doesn't. Instead, people experience a constant need to clear the throat, morning mucus. Hoarseness. A dry cough, sensation of something stuck in the throat, frequent throat irritation, because these symptoms occur in the throat rather than the chest. Many people assume the problem starts there, but in reality, the source may still be the stomach. One reason for this involves a digestive enzyme called pepsins. Normal job is simple. It helps break down proteins inside the stomach. That's where it belongs. The problem occurs when pepsin travels upward during reflux episodes. When it reaches the throat, it can attach itself to tissues that were never designed to handle digestive enzymes. And even after the reflux episode is over, pepsin may remain there. Waiting. Then something interesting happens. When acidic foods or drinks are consumed later, pepsin can become active again. This means irritation may continue long after the original reflux event. For many people, this explains why throat symptoms seem persistent and unpredictable. They assume nothing happened, yet the irritation continues. Not because new reflux occurred, but because previously deposited pepsin became active again. This is one reason. Silent reflux can be so frustrating. The symptoms don't always match the timing of the reflux itself. Now let's discuss another mistake. Many people focus entirely on reducing acid. They take stronger medications. Higher doses, longer courses, yet they never address the pressure problem. Think about that for a moment. If a door won't stay closed because someone is constantly pushing against it, painting the door won't solve the problem. The pressure must be reduced. The same principle applies to reflux. The valve must be supported, pressure must be managed, digestion must be optimized. Otherwise, the cycle often continues. This doesn't mean medications aren't useful. Sometimes they are extremely important, especially when there is inflammation, ulceration, or significant tissue injury, but medications alone may not solve the mechanical component, and that's why many people continue struggling despite treatment. Now here's the encouraging news. Many people experience meaningful improvement when they combine medical guidance with practical lifestyle changes, reducing meal size, avoiding late-night eating, improving sleep position, managing abdominal pressure, identifying personal triggers, supporting healthy digestion. These simple strategies often work together. Small improvements become larger improvements. And over time, symptoms begin to calm down. But before we finish, there is one final subject we absolutely must discuss, because not every cough is reflux. Not every throat symptom comes from the stomach. And certain warning signs should never be ignored. That's exactly what we'll cover next. Part 5. The warning signs you should never ignore. Before we finish, I want to talk about something that may be even more important than everything we've discussed so far, because not every throat symptom is reflux. Not every cough is caused by the stomach. and not every digestive problem should be treated at home. One of the biggest mistakes people make is assuming every symptom has a simple explanation. Sometimes it does. Sometimes it doesn't. That's why it's important to know when professional medical evaluation becomes necessary. Let's start with difficulty swallowing. If swallowing is becoming progressively harder over time, that's not something to ignore. I'm not talking about food going down the wrong way once in a while. I'm talking about a pattern. Food feeling stuck more often. Meals becoming increasingly difficult. Needing extra water to help food pass. These symptoms deserve attention. Another warning sign is unexplained weight loss. If you're losing weight without trying, especially after 60, it's important to understand why. The body rarely loses significant weight without a reason. And that reason should be investigated. The same applies to anemia. Fatigue. Persistent weakness or symptoms that continue worsening despite treatment. Then there's bleeding. Blood in vomit. Dark coffee ground-like material when vomiting, black or tar-like stools. These are symptoms that require medical evaluation. Not next month. Not when it's convenient. Promptly. Chest pain deserves special mention as well. Many people assume chest discomfort must be reflux. Sometimes it is, but heart-related symptoms can look surprisingly similar. If there is any uncertainty, always take chest pain seriously. Never assume, never guess. Get evaluated. Now, here's another important point. Some medications can mimic reflux symptoms. Certain blood pressure medications, particularly ACE inhibitors, are known for causing a persistent dry cough. Many people spend months treating reflux when the real cause is actually a medication side effect. That's why reviewing your medications with your healthcare provider is always worthwhile. If symptoms suddenly appear, now let's step back and look at the bigger picture. Everything we've discussed today points to one simple idea. The stomach valve is influenced by more than acid. It's influenced by pressure. Body position, meal size, digestive timing, weight distribution, food choices, lifestyle, habits. And overall digestive health. That's why there is rarely one magic solution. Most lasting improvements come from addressing multiple factors at the same time. Think of it like closing a gate. If 4 different forces are pushing it open, removing only one force may not completely solve the problem, but when several pressures are reduced together, the gate begins to stay closed more naturally. The same principle applies to reflux. Eat slightly smaller meals. Avoid lying down after eating. Sleep on your left side when possible. Reduce excess abdominal pressure. Identify personal food triggers. Avoid habits that weaken the valve. Give your digestive system time to work the way it was designed to work. These strategies may sound simple. But simple doesn't mean ineffective. In fact, some of the most powerful health improvements come from consistently applying simple principles over time. After years of helping adults understand digestive health, I've noticed something interesting. The people who do best are not always the ones with the perfect test results. They're often the people who understand their bodies, the people who pay attention, the people who notice patterns, the people who make small adjustments before problems become bigger. And that's really the goal, not perfection. Awareness. Because when you understand what your body is trying to tell you, you're in a much better position to help it. If there's one thing I hope you remember from today's discussion, it's this: reflux is not always an acid problem. Very often, it's a valve problem. A pressure problem, a positioning problem, a lifestyle problem. And sometimes, addressing those factors can make a remarkable difference. Take care of your digestive system. Protect your stomach valve. And remember that lasting improvement often comes from understanding the cause, not just treating the symptom. Thank you for spending this time with me today. If you found this information helpful, be sure to subscribe to Dr. Amelia Heart Health for more practical Science-based health insights designed especially for adults over 50. Until next time, take care of yourself, stay informed, and stay healthy.